Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. And we have a great guest on today, Noosheen Hashemi. She is the founder and CEO of January AI. Noosheen, welcome to the program.
Thank you for having me, Tom.
Awesome. So the rage in healthcare is AI, but I think you come at it, you and January AI come at it a bit differently, and we'll talk more about that during the program. And that's why I wanted you to come onto the program to, one, help educate the audience about the great things that January AI is doing and how it influences outcomes in the overall delivery of care. So tell us a little bit about yourself, and tell us a little bit about what provoked the startup of January AI.
Sounds great. Yeah, I was born in Iran, came to the US when I was 14 years old, went to high school and college, started working at Oracle. I worked there for about 10 years and then participated in the .com boom. The company that I went to as head of sales and marketing, Quote.com, got sold. I had a year opportunity to get out and see the world. And then had a couple of kids, couple of foundations that I set up, and then back to the dark side in 2013 and started January in 2016 with the goal of bringing multi-omics to the masses. So I had a chronic condition that I was dealing myself. I was dealing with both of my parents' health. One of them was misdiagnosed and almost died. She was misdiagnosed as having asthma. She actually had heart failure. My father was diagnosed at stage 4 for a second cancer when he had been under the care of oncology for 8 years for his first cancer. So he passed away. And I was very angry about all this. I felt like we should know way, 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 way sooner when we can actually do something about all these problems. And so I was looking for solutions, and I'm a really, really good researcher. And I was, peeling the onion over and over and trying to find the answers. And I came to this idea of multi-omics and Mike Snyder, this idea of having a whole picture of your health. Today, when we think of whole health picture, we think of social, emotional, and we think of, physical, mental, and social health. But your physical health alone has many, many angles. There's you can look at your health from a genomics perspective. You can look at your health from microbiome. You can look at your metabolic and lipid and immune panels. You can look at your wearable data. You can look at your lifestyle, like what are you eating, how you can look at how active you are, etc. As you put all of these pieces of the puzzle together, a picture of your health emerges that actually can predict what kind of disease might come your way. This is what we call precision health. It's upstream from precision medicine. Precision medicine is sort of matching your drugs to your disease. Precision health is looking at the whole person and coming up preventatively with, predicting what disease they might have and being able to, they may develop in the future, and then trying to predict that, prevent that, postpone that, and if they've gotten it, to manage that. That's what we call precision health. So our goal was to bring multi-omics to the masses. Mike Snyder and myself, when we met, we were like, I said, that's what I'm passionate about. He said, well, I have type 2 diabetes. Why don't we go after diabetes? And the cheapest way we can do this is with wearables. So we went after how we can use a smartwatch for health in combination for a continuous glucose monitor. So at this point, we're going after metabolic health. We're going after it with wearables. And we did a bunch of studies and work. We were stealth for 3 years. We did a bunch of research. We realized that food was actually the most important predictor of glycemic response, more so than any other thing, because your glucose levels, your blood sugar is dependent on so many things. How much you think, glucose is basically a source of energy for your body, and think of it as gasoline kind of for your body. but it's impacted. How much of it you produce is impacted by like how much your body needs, like how much you're thinking, how much you're sleeping, how much like what you're eating, how much stress you have, and so on. So we quickly understood, okay, we understand what's happening to your glucose. We understand what's happening from your smartwatch to your heart rate and everything, but we don't know what you're sticking in your mouth. We need to understand what you're eating, what the inputs are, what the nutritional inputs are. So we set out to sort of understand what people were ingesting and quantifying what they were eating. And of course, quantifying food is very difficult because, logging is difficult, because quantities aren't correct, because USDA information can be 20% wrong itself, because government doesn't require local restaurants to have nutritional information, right? Only chain restaurants are required to provide nutritional information. But we were very, very audacious. We set out to develop this huge database, which at the time had 14 million foods. Now it has 34 million foods in it. It has millions of recipes, has all the US groceries, it has all the chain restaurant menus, it has all local restaurant menus, whatever you can find in Yelp. And it has branded foods, generic foods, etc. So we created this huge database to start with. Then we used machine learning to enrich this database with nutritional information so that wherever the nutritional information was missing, like macros, like carbs, protein, etc., we came up with that. That took years. We also developed glycemic index and glycemic load of foods because we wanted to understand glycemic index is a better indicator of glycemic response than carbs alone. Carbs are very important, but you never eat carbs really all by themselves. I mean, nobody just like eats spoonfuls of sugar. So to the extent that you're also eating protein and fat and fiber, we need to understand their impact on your blood sugar. So we did that. And then, we ran a clinical trial for a year and a half. We had over 1,000 people participate in the trial, and we associated their glycemic response to the glycemic index of foods they were eating and glycemic load of foods they were eating. That's where our prediction model came from. And then we were able to predict people's glucose response to any food they were eating. So if they ate fried chicken and cereal, etc., during their 4 days of training, but now they wanted to know the response to chicken cacciatore or pepperoni pizza, we could now predict that. That's the power of AI. When, I've had people go, how can you predict the response to something the person never ate? Because I saw the response to all the things they did eat. And that is the power of AI. AI is magical. A lot of people don't understand AI. They just think it's made up, but it's not. It's very scientific. It's very real. It's based on real data. And we put that prediction model into the first version of our product. It was very successful. We got people to eat fewer carbs, fewer calories. We got them to eat more protein, more fiber. They spent more time in range, in healthy blood glucose range, and they lost weight. And the heavier they were, the more weight they lost. So that was very, very successful. But the product was a little bit clunky, so we sunsetted that product and we created our version 2. Which was more purposeful with regards to AI training and insights. And we added, other wearables. And then most recently, our version 3 is in the marketplace, this freemium app that actually uses no sensors at all. So we've taken data from years and years of clinical validation and thousands of people and millions of data points trained on CGM. And now we're able to offer a free product to everyone to be able to get educated about their blood sugar, because knowing your blood sugar is very, very important, and managing your blood sugar is central to all health.
So this is what I like about January AI and how they're coming about the market. Typically, when there's innovation in the market, it's really all provider side for the most part, right? EHRs help supposedly the providers, and everything that's the analytics and things of that nature are all insights on the provider side. What January AI does, and I have the app myself, it helps the consumer. So if the consumer is wanting to really be certain that they want a different outcome and live a different life, this tool is very powerful. To your point, the heavier they are and the more engaged they are, the more that they lose and the better the outcomes. That to me is the missing equation in healthcare. I've often said the care transformation is focused on the wrong side of the equation, right?
Mm-hmm.
The outcomes, and my audience has heard me say, 5 chronic conditions, 9 different doctors. At the end of the day, I am alone, if you will, for 8,745 hours in a given year. What I do in that time is really going to project and predict my outcomes. And that's where January AI comes in, because it's the one that's going to help educate the consumer when they need it most, because they're going to call their doctor and their doctor's not going to be available because they're in and out of the exam rooms all day. So that's what I like about January AI and the results that you're getting, even now with version 3, about not even having a sensor, but being able to project where your glucose level is going to be. It is an outstanding achievement in my view. So tell us a little bit more about where you are with version 3 and where you're going with that platform.
Thank you, Tom. Yes, I believe that our job is to invite people to onboard to their own health journey and own their own health journey. We believe, we're passionate about bringing agency to people. We don't think governments can make you healthier with their government policies or whatever. We don't think doctors can make you healthy because they're busy. They are not trained in preventative care. They are not incentivized for prevention, and they don't have time to spend with you. That's not how the current system has been set up. We also don't think that your community necessarily can make you healthy if you're not yourself invested in your own health. So our dream and goal is about agency, 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 agency. How do we set people up for success? And we think AI is a great tool to help people become essentially self-managers, self-managing of their own health and becoming CEO of their own health. And how so? Well, all the core principles of good habits, of good behavior can be nudged forward, can be helped with AI. For example, just what you're about to eat today. So AI can see if you have a coach that is really committed to your health, and an AI health coach can be there for you 24/7. They're omnipresent. They know everything. They know not only everything, period, that's ever been written about anything, but they also know you. They know how much you've moved. By just simply taking pictures of your food, they can see what you're consuming. So simply just go around, snap photos. They can see what you're eating. You don't have to do much more than that. Yeah. So they can help nudge you towards healthier foods, healthier alternatives. For example, if you go to the January AI and you put in, I'm eating this chocolate bar, it can give you an infinite number of other bars. You can put in this energy bar. It can give you alternatives for other energy bars or other snacks you can have. You can essentially, AI can tell you, hey, if you eat this food and you need to walk X minutes to bring your blood sugar into a healthier place. So it can help you with nutrition. It can help you with when you should move. It can help you with better sleep because it can know whether you're eating too close to sleeping time. If you just simply take a picture every time you're in front of food, that's all you're doing. It can tell you, hey, the gap between your last meal and your sleep is too short. You're taking a 2-hour gap, and your gap should really be 3 hours. Research shows us that you want a 3-hour minimum gap between your last meal and sleep. So AI can help you with fasting. It can help you with nutrition. It can help you with movement. And when it matters, it can help you with your sleep. It can also remind you to do minutes of meditation. It can really help you with all those principles, but not in a generic way. It can do it in a hyper personalized way. If you eat, like I was giving you a burrito as an example before, if you normally eat a burrito on a Tuesday, it can offer you other burritos before you even think of eating that burrito on Tuesday, because it knows you're going to do it. And it's going to say, hey, Tom, here's 5 other burritos you can walk to that have lower saturated fat, they have higher fiber, they're going to spike your blood sugar less. Or here's a burrito recipe, go make this at home. Or here's a frozen burrito in the grocery store that is actually healthier than anything that's out there. You can take that to your work. It's easy, convenient to use, meaning it really makes everything so convenient, and it's hyper personalized to you. And as far as adopting healthy habits for everyday life go, which is what prevention is all about, AI can be a huge help.
Yeah, I listen. What I didn't realize until hearing you speak more just now is that it is really January AI. The app is more of a 24/7 coach, and it knows you like nobody else knows you. right? Because again, I'll go to my doctors for 15 hours in a given year, but those are 12-minute intervals, and just enough to get your script fulfilled for the most part, right? So the idea that I have a 24/7 live-in coach that's going to help guide me along the way. I'm very close to the remote patient monitoring, chronic care management, and we know even in that scenario, patient engagement is critical if you're ever going to get close to any meaningful material outcomes relative to those programs. This goes even a step further as an extended partner in that model where, even the care manager is only there an hour a month, right? Where January AI is side by side with you along the journey. And I think that just provides a boost of confidence, if you will, for the patient, because they know where they can go hypothetically to get an answer or a guidance on what burrito to eat. Or, geez, I'm thinking about. I just walked past a table at a restaurant and I took a picture of somebody's dish and said, "Hey, how's that going to impact me?" Right?
Absolutely, 100%. I mean, you can also hack your burrito. So you can hack it. You can see, what if I swap out this tortilla for this other tortilla? What if I eat half of the tortilla? What if I eat half of the pizza crust and not all of the crust? A lot of people leave the crust behind because they know, you don't need to eat all that bread. You can still enjoy a taste of pizza by not having it. You can get all of these answers from you literally can say, hey, what happens if I don't eat the top bun of the sandwich? Does that really make a big difference in the blood sugar? You can see what kind of a difference it makes depending on your age, your gender, your height, weight, your ethnicity, etc. We can figure out, okay, we've seen this before for this person. We think this is going to have a very high impact. For example, if you're very, very active, if you're truly metabolically fit, it's okay for your blood sugar to go up and down because you are so fit. You can go from fast to fed with great efficiency. But for the rest of us who are not that metabolically fit, we need to reduce the metabolic assault on our bodies. You don't need these very high sugar spikes. I tell people I'm on this crusade to get people to reduce the amount of fruit they put in their smoothies. You just don't need an entire banana. You can put in the protein powder, the collagen, you can put in your fiber. You don't need a whole banana. You don't even need, some people are now replacing it with avocado because it's healthier for you. It gives you the creamy feeling without having all the sugar. One banana is 27 grams of carb. You really don't need that per se. So I think you can experiment. That's the beauty of AI. Before you even stick it in your mouth, you can just see, what if I ate this? What if I ate that? What if I had half of this with half of that? What if I cut out this? What if I tried this recipe? I want to make pancakes for my kids this weekend. Is there a low carb pancake recipe that's going to be good for me? All of that, 34 million foods in a database. You can take pictures, snap. If you're in front of, you can also use your food. Doesn't have to be in front of you. You can upload photos you've taken before, or you can just look at pictures on the internet and literally see how it will do. You don't need to actually be in presence of food. But if you're sitting at Cheesecake Factory, if you are in McDonald's, if you are in a chain restaurant, you can simply go to January and look up your blood sugar response, personalized to you, by searching for that food in that restaurant. It's super, super, super easy. You don't need to even order it to know how it's going to impact you.
And what the audience may not know or be aware of yet, if they haven't seen any of your published studies, is that in that all that comparison, that picture taking, that projections and things of that nature, you've done the homework of comparing that to data when a person was wearing the CGM, continuous glucose monitoring. Right. And you can see a very high correlation between what you're projecting and what the medical device is projecting as being relatively the same. I don't want to put words into the study's mouth, but that's what okay.
That's exactly right. You have to appreciate everything for its own mode. For example, people who prick their finger, they get a number. When they put the blood, actually drops of blood into the glucometer, they get one number. If they wear a CGM, that is an approximation. That's a different number. That is not the same thing as a glucometer. It will be different because here you're reading interstitial fluid. which is correlated with glucose in your blood, but it's not exactly glucose in your blood as it would be in a glucometer. And then our numbers, our models when people use CGMs are fairly similar to CGMs. They're almost like CGMs. When we predict people's CGM values, when you go off of CGMs, they're off by a few points. But of course, the benefit that you're getting is that you're not going through the expense of buying a CGM. You're not sticking one in your arm. You don't have to, half of America can't afford to pay out of pocket for a CGM. And the only CGMs that are covered by insurance right now are for people that are intense insulin users. That means they are poking themselves 4 times a day. Those are the only people that are covered by insurance right now. So whether you're type 1 or type 2 doesn't matter. If you are intense insulin user, then insurance covers your CGM use, and otherwise it does not. And we want to bring that CGM experience to everyone, whether they can afford it or not, whether they insurance covers it or not. We want to make sure that everyone gets to have that CGM experience. And so the science is there for us to do that.
And so how does a consumer listening and others, it's just a matter of going to the App Store, is it not? And downloading the January AI, or am I ahead of the curve here?
No, you're absolutely right. We have January for iOS right now. You can go to the App Store. We were on the Today Show 2 weeks ago on Friday. That was amazing. If you haven't seen that, I would love to share that clip. I don't know if you have podcast notes. We can put in the podcast notes so everyone can see that clip from the Today Show. We made it to the number 5 on the App Store for a bit, and we were in the top 100 for a few days. That was fun.
That was awesome.
Yes, that was really, really awesome. So yes, we have iOS. You can go download it and onboard and start looking at just, again, snapping pictures. Just snap photos. That's it. Snap a photo, see the impact.
So what's coming? We have 3 minutes left. What's coming in the next iteration of January AI?
The biggest thing coming next is going to be our AI health coach. So this, her name is Jan, and she is an agent that lives inside January AI. And you can ask it any questions you want, like how have I been sleeping, or what was I eating 5 days ago for lunch, or what should I eat tonight for dinner, or what's the latest tonight I should eat at all, and what's on average, what was my last meal sleep gap, and how can I improve that? Hey, I feel like eating something healthy for breakfast. What should I eat? And it will give you all that information with blood sugar, which is incredible, which no one else will be able to give you. So the health coach is going to be the biggest thing that is coming in Jan. It should be working like a Conmigo works in Khan Academy or something like that, like a coach that you have that knows you, that can give you information about your specific data, what you're logging, what your food logging, about your wearable data. Once we hook up wearable data, I think we're doing Apple Health Kit right now, but we'll be adding more wearables, including continuous glucose monitors over time to the freemium. Right now, it's only available in our Pro product. And so the biggest thing is being able to have a health coach that understands your blood sugar, understands your relationship with food, and can make all sorts of suggestions to you, can give you alternatives. The app can do that as well, but then you'd have to go fetch it from the app. This one, you don't have to go fetch. You can just, you can talk to it and get things from it fairly easily.
Is that an audio-based avatar, or is there a true avatarish image that is used?
We should be able to currently, even now, right now in the January AI app, you can voice currently. You can voice you can say, I ate a burger and fries and shake. You can voice that now and it will log it for you without you actually typing it. But Jan, I think she's a text box in all the designs that I've seen, but we could easily turn her into a voice so that you can use voice. I love voice. I've been using voice a lot because I'm driving. I just want to know something. I have a question at the top of my head right now. I don't want to write it down. I can't stop mostly in driving when I'm doing something else and I can't text. I love just to ask questions. Hey, what should I worry about? Or my sister just got this diagnosis. What does this mean? Or and with voice, you can do all that very, very easily. You don't have to go fetch the data in an app.
I
That's our
agree.
future.
It is the greatest and most productive interface going. Fingers off the keyboard has got to be a part of the solution for sure. So,
Yes.
Noosheen, I am very appreciative of your time, and I personally believe January AI is just rocking it, if you will. And to me, it is a model platform for consumers to embrace if they want to do anything in regards to improving their health. So yeah, yes, use the device, all true, but at the end of the day, you need some guidance as to what you place in your mouth and how it's going to impact you before you even do it, right? So you got to
Bingo.
live with the consequences, if you will, but at
Exactly.
least you know what they're going to be. So any last words before we go?
No, just super excited for AI. I just tried recently with voice. I was doing this with ChatGPT 4.0. I said, hey, I'm a little sad. And when I'm sad, I eat a lot. And the answers it gave were so beautiful. And it said, have you considered how you feel after you eat those things? I said, I want to eat all the time. And it said, have you considered how you feel after? And I was like, oh my God, I love this. I can talk to this forever.
Awesome. Well, we're going to leave it there. Thanks once again. You always have an open invite to come back onto the program and tell us more about your progress. With that, thank you.
Thanks for having me.
That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.